Everyone, welcome to the first NMatch Program Director panel for this season. My name is Roshni Chandrasekhar, and I'm joined by my fellow NMatch member, Kate Bailey, to host tonight's panel. So we're very excited to have wonderful PDs with us here tonight, and I'm sure you're going to hear varied opinions, and I think their insight will be extremely helpful. So I'm just going to give a quick layout of how tonight's panel is going to go. We're going to have individual presentations from each of the PDs, probably lasting around 7 minutes, about what they're looking for in applicants, maybe talk about their programs a bit so you can hear from them directly. And then we'll sort of navigate into a Q&A session. And we have questions that, we've been asked on our socials by attendees, and we'll be asking those as well as, any questions that come in our Q&A. We do want to tell participants that the chat is disabled, so make sure to type your questions in the Q&A box. Okay, I'm going to pass it over to Kate, who's going to introduce our panelists.
Okay, so we have 4 panelists here tonight. We have Dr. Edward Yu of Staten Island University, which is affiliated with Lenox Hill Hospitals. Dr. Asaff Harel is going to be joining us a little bit later. He is from North Shore University Hospital, which is affiliated with LIJ Medical Center at Northwell Health. We have Dr. Jonathan Cahill from Brown University, which is affiliated with Rhode Island Hospital. And then we have Dr. Buse Sengul, which is from Memorial Healthcare System. So Dr. Edward Yu, if you want to start, and I will stop sharing so I can give you sharing privileges, okay?
Great. So thank you first for inviting me to this panel. Great to have my fellow PDs here with me to kind of introduce ourselves to your students. So let me just share my screen. Just real quickly, so I'm the program director for Staten Island University Hospital, Lenox Hill Hospital. We're a program located in New York City. We're actually affiliated with Northwell Health as well. So we're the sister program to Dr. Harel's program, which he'll talk about later. So let me see if I can share my screen here. Okay, can you guys see my screen, my slides? Okay,
yes,
great. So again, it's a mouthful, but we are the Staten Island University Hospital, Lenox Hill Hospital, Doctor School of Medicine at Hofstra University Northwell Health Program. Obviously, I've had some training in this, but basically, for short, we're Staten Island Lenox Hill. Okay, and we are a part of Northwell Health. So for those of you who are not familiar with Northwell Health, we are actually New York's largest healthcare system. We actually have 23 hospitals in the New York City area. We actually employ over 3,000 physicians. So we're a pretty big system in our area. We're located in New York City, and Long Island, and Westchester. And more importantly for all of you guys, we're actually one of the largest PME programs in the country. So we actually have over 1,900 residents and fellows. We have over 200 training programs within Northwell Health itself. So we have a pretty dedicated graduate medical education office. Just a little bit of a geography lesson here. So obviously this is the United States. Our program is in the United States, and we are specifically in New York State at the very tip here. And you can see here, this is New York City. We have 2 hospitals. We have one hospital at Staten Island University Hospital, and we have the other one at Lenox Hill. Lenox Hill is located in Manhattan, which is one of the boroughs of New York City, and Staten Island is obviously located in Staten Island. So technically, we are a New York City program. Now, Staten Island is the smallest of the 5 boroughs. When you think about New York City, you really think about Manhattan. So I'm going to introduce a little bit to you guys about Staten Island. So Staten Island itself is a population of almost 500,000 people. Pretty diverse population. We have about 75% Caucasian, 25% minority, mix of Black, Latino, Asian. We have about a quarter of the population is actually immigrants. So a lot of Eastern European, Asian immigrants to our borough. We actually have also pretty, it's the least populated borough in New York City. But that also means that we have a very diverse selection of neighborhoods to choose from. So we have a lot of, we have neighborhoods that are more urban, we have neighborhoods that are more suburban. We are actually called the borough of parks with many open green spaces. So, when you think about New York City, you think about an urban environment, concrete jungle, but we actually have over 170 parks in Staten Island alone. It's easily accessible to Manhattan, to the rest of the city via ferry, bus, or car. It is the most affordable housing in New York City, so that's actually important for our residents. And we also have easy access to transportation. So we have free parking on site at our hospital at Staten Island, and then we have multiple express buses that takes us into Brooklyn and Manhattan. We have two campuses. So again, one in Manhattan, one in Staten Island, and the two campuses allow us to have a pretty broad, diverse range of populations. So the population in New York, in Manhattan, is a little bit different than the population of Staten Island. So I think with the two training sets, it really gives you a nice broad selection of patients and pathologies. And with that broad experience also comes a lot of opportunities to focus on very specific interests. All of our faculty are self-substitute trained. Our Lenox Hospital is a 450-bed tertiary hospital. It's an academic research center. It was featured on Netflix. I don't know if you guys still watch that, but it was one of the hospitals that was featured in the Netflix show. It's located in New York City's Upper East Side. It's a pretty hustling, bustling area, and has a very long history and tradition as one of the leading innovators of healthcare since 1857. So it's a pretty old hospital. Staten Island, I didn't know this until I actually arrived here, but we actually are one of the oldest hospitals in the country as well. So it's founded back in 1861 to treat poor immigrants. We're almost 700-bed level 1 trauma center. We're a concentrated stroke center. We're a level 3 epilepsy center. So we have a lot of patients coming through. And also, we're also one of the largest teaching hospitals in New York City with over 300+ residents and fellows. So that's basically a little bit about us. You can follow us on our website. You can also follow us on social. And just a plug for our own open house. So we have our open house coming up on September 4th. So here's the QR code. You can actually get a flyer from NeuroMatch. I'm sure they can send it out. And then you can also find the flyer on our website as well. So that's my quick little blurb. So pass it on to you guys.
Okay, thank you so much, Dr. Yu. That was a great presentation of your program. So next up on the docket is going to be Dr. Cahill. So I'm going to pull up the presentation again, and we are going to start from here.
Thank you, Kate. Thank you, Roshni, and the organizers of NMatch for having us here. I have a few slides about our program. I won't be more than a few minutes in discussing these. The QR code that's on the screen there should take you to our website. The photograph in the back is an aerial view of Providence, Rhode Island. That's where I'm coming to you from. About 3 hours drive from New York City, which we just heard about, is the lovely little state of Rhode Island, and the smallest state in the country. Providence is our capital city and largest city, really the only city in Rhode Island. The basics of our program is that we are an advanced program, which means that a match with us in the spring of 2025 is to start PGY2 neurology residency in 2026. We participate with ERAS and the NRMP, and you can link to our website to find all this information as well. Our preliminary year in internal medicine is required, but you don't have to do it with us. If you match with us in the neurology program, a seat for you is held and guaranteed for you if you choose to do it here at Brown. Most of our residents do take that option, but if you had a reason wish to do preliminary year elsewhere, that would also be fine. We have 7 residents per year. We just expanded from 6 to 7, so we have 19 residents this year. And our primary site is Rhode Island Hospital. Rhode Island Hospital is the largest hospital in the state. It's the only tertiary care hospital in the state with the tertiary services you might imagine. When it comes specifically to neurology, comprehensive epilepsy, comprehensive stroke program, all the different subspecialties of neurology. And in addition to being a comprehensive center, because there are no state, county, city hospitals in this region, it is the de facto safety net hospital also for the people of Rhode Island. There's about 1 million people who live in the state, and Rhode Island Hospital provides far and away the largest amount of free care, uncompensated care, to a diverse range of people from all different backgrounds. And so you're exposed to that as a resident. You can go to the next slide, please. Oh yeah, that little red arrow is our hospital. One more forward. There we go. So there's a few buildings, sort of gray concrete buildings on the distant edge of town in South Providence. That's where our hospital is. As I mentioned before, we participate with ERAS. We use Thalamus to schedule interviews. Our interviews take place between November and January. All of our interviews for the upcoming season will be virtual again by Zoom. We do have an in-person second look option on a couple of Fridays in February after the conclusion of all interviews and really the completion of our program's rank list, so that your attendance or non-attendance at our second look events does not impact the ranking. You can go to the next slide, please. I would say that we provide comprehensive training in clinical neurology, teaching, research, advocacy, leadership, quality improvement, community outreach, and the list goes on. So whatever you're interested in, I know you'd find resources in that area here at Brown. The connections to the larger university, Brown University, a major research institution, can't be overstated. For specifics about rotations, please visit our website, but we have residents rotating through all the different subspecialties of neurology: inpatient and outpatient neurology, child neurology, psychiatry, electives, continuity clinic, and all of that. One of the highlights that I like to point out about our program is that it's all very one-site centered. So all of our residents are on campus at Rhode Island Hospital, training every day. We have 2 academic conferences every day at 8 o'clock and 12 noon so that we bring residents together. And I think it really creates a good environment where residents learn from one another and are embedded within our faculty practices and with each other all day, every day. We offer funded travel and registration. If you're a resident presenting at conferences, there's an additional educational budget for each resident outside of their own presentations, but that you can tap into. And I mentioned earlier just that we are affiliated with and have medical students, rotating students from Brown Medical School. And then next slide. We have 7 fellowship programs at Brown: clinical neurophysiology. These are in roughly chronological order as to when they were created. Epilepsy, we have multiple sclerosis fellowship program. That's my own subspecialty field, multiple sclerosis. Vascular neurology, behavioral neurology, neuropsychiatry, movement disorders, and neuro-oncology. And the next slide. What do our residents do when they finish our training program? A large piece of the pie is clinical neurophysiology fellowship. We've had a big portion of people do stroke or vascular neurology, followed by the remainder of those fellowship programs. Almost all of our graduating residents pursue fellowship afterwards. 2 residents in the last 10 years have entered practice, but I will point out that they had both completed a combined 6-year neurology psychiatry training program, and so they had probably had enough of residency training after the end of 6 years. So that's where that was. And I think that's it. There was one line just on a previous slide that I think got cut off by the projection, just mentioning that ECFMG J1 certified candidates are encouraged to apply. We do not sponsor an H-1B visa. We have currently 2 of our 19 residents who trained at medical schools outside the US. So like was mentioned in the Q&A box somewhere, the focus on holistic review is definitely something that we take to heart, and all applications are reviewed in their entirety before we make decisions about interviews and things of that nature. So with that, I will stop talking, and thank you very much. Look forward to the Q&A.
Okay, thank you so much. Okay, so we have Dr. Buse Sengul from Memorial Healthcare System. And so that is located Hollywood, Florida. Is that correct? Okay.
Yes.
So I always am so interested in, geography of different programs. So let's get started.
Thank you very much for having me here. It's a pleasure. So I just like Kate, sorry, mentioned, we are in South Florida, so it's Greater Miami area. I think I have a few slides coming up to show exactly where we are. So please, next slide. So yes, this is it. So as you can see, this is a map of Florida. So we are right in South Florida, and you can see that we are in the Greater Miami area. So many of our residents actually live in downtown Miami area. So, but it's just like the city is called as Hollywood, in case you are not familiar with that. Please, next slide. So Memorial Healthcare System, let me tell you a little bit about Memorial. So it is a large, very, very large healthcare system here in South Florida. And it is consists of 6 acute care hospitals, multiple employees. We have got both employees part of the Memorial Physician Group, but also other employee groups as part of that. It's a community hospital that about like 10 years ago from now, really wanted to go into residency and graduate medical education. Next slide, please. So this is, Memorial is actually recognized, I think this was from a few years ago, as the 3rd largest public hospital system in the US. And you can see especially the 6 big hospitals here. Memorial Regional Hospital and Memorial Hospital West are the main training sites for neurology residents. Memorial Regional Hospital South is actually a very famous rehabilitation hospital with a very competitive PM&R residency. And Joe DiMaggio Hospital is one of very, very well-known pediatric hospitals here in South Florida. Next slide, please. And as I mentioned, these are the main training sites for Memorial Neurology Residency and Memorial Neuroscience Institute. Next slide, please. So as I mentioned, Memorial, yes, sorry, the dates appeared a little wrong here, but Memorial is a very well-known and very famous public hospital system, community hospital system in South Florida. And about 10 years ago, they really wanted to go into academic side of the world, especially with educators like deciding that they really want to first start with GME and potentially in the future even maybe very, very near future, even with academic ties to a medical school. And they started the GME plans in 2015. Neurology residency was accredited in 2018. And I believe I have got more information coming up here. And then neurology, the first residents were hired in 2019 and they graduated in 2023. So we had 2 classes that graduated in 2023 and 2024 this year. And next slide, please. And by the way, in the previous slide, that was, if you can go back, actually, oh, this is actually the photo in the corner is from our welcome party. We are in a boat in Miami shore, I guess you can say. And this was our new incoming class of residents. Next slide, please. So our residents, this is a group of our current residents, and this photo was taken actually from our current residents. My dog is barking. So this photo was taken the day that our current residents had their orientation day. We have a categorical program. That means that you come to us, you start with our PGY1 internal medicine, and then you are with us for 4 full years and training entirely in neurology. And we do not need you to go to any outside place because we have got all the subspecialties in Memorial System. We have got 4 residents per year. Next slide, please. And these are our first year graduate residents and where they went to. And one of them went into vascular fellowship. The other 3 decided to become neurohospitalists, and one of them is actually a current faculty as a neurohospitalist at Memorial Healthcare System. Next slide, please. And this is our final year graduates, and one of them went into, sorry, this slide I think shifted again. One of them went into Duke Neurology, and one of them went into another healthcare system as a neurohospitalist in Orlando, and another one in Indiana, and one of our residents actually went to neurophysiology fellowship at USC. And this is a photo from our graduation, and this was our residents' neurology bag as a graduation gift, with their names engraved. Next slide, please. So this is what our typical schedule looks like. As I mentioned, we have got 2 big hospital sites with inpatient services there. So obviously the residents rotate through the inpatient service during their PGY2 residency. PGY1 is obviously much more into internal medicine, but the residents do rotate through psychiatry and get that requirement done during that time. And with the PGY3 and 4, the residents get much more in the ambulatory world. And with PGY4, they come back to the inpatient world as seniors. And as I mentioned, we have got pediatric hospitals, so our residents do their pediatric neurology rotations in that pediatric hospital. We have a big group of neurologists, so we have got representation of almost all the subspecialties. And during the ambulatory blocks, we divide it into certain subspecialty blocks that the residents can rotate. As you might see here, we have got night float system. So all the residents do at least two-week night float blocks, and as a PGY2 they have an extra month of or extra 2-week block of night float. Next slide, please. Before I go into benefits, we actually do our academics as Academic Wednesdays. So Memorial is a very supportive system to GME. So our residents actually do have their didactics and didactic training on Wednesday afternoons, and they are protected from any clinical work, and we are able to go through multiple different things with our own faculty presenting, sometimes even guest faculty, and that is one of the advantages. So some of our benefits, really competitive salaries, no Florida state tax, and we have got actually a few years ago the benefits increased number of the PTO, so now our residents do get 25 days, which can be 4 weeks plus the any holidays. So our residents do actually have, just like any other attending, they have physician lounge access, and so which means that they have got 24/7 free food access in the hospital. They have got very competitive wellness programs. They get very competitive educational stipend that comes as like a check in the beginning of the year where the residents can purchase any academic or any books that they want, or any other device. And actually we do buy 3 to 4 textbooks to our residents every year, depending on their educational year. We also have research stipend that we can support their research interests and send them to the conferences if needed to. We do give our residents 1 computer each, and we don't give them phones, but we do give them phone expenses. So if they want to get their own phone and have a different hospital phone, they can, or they can use their own phone and just keep the money. And obviously we have AAM membership, ANEM membership, and continuing membership. Next slide, please. So who are we looking for? This is as I said, this is a community hospital that is really diving deep into educational opportunities and really doing our best with education, but this is still a busy clinical work. So while I do definitely have a holistic approach, I would like the residents to be almost close enough to the graduation. Of course, like if there's any research or any other interest that made the residents go into that before they applied into residency, that is another thing. But we typically like the applicants to be close enough to the medical school, so fresh into their medical abilities. Enthusiasm is a big thing for us, and really, I mean, it's a busy clinical system. As I mentioned, we would like clinically strong candidates. We do not have any score cutoff. We really need people to be passionate in neurology, those people that really want to be a clinical neurologist. As I said, we have got so many research options, and research is really something that we can support, but that is mainly clinical research. So that is, I think, would be an ideal candidate for Memorial Healthcare, somebody that is really interested in clinical neurology and clinical research, that wants to really be in the community and take care of the community patients. I would like to see, that enthusiasm, and I think neurology letter of recommendations really are able to give that enthusiasm. That's why I typically look for them, but it's not a complete must. And then if you had a neurology research, it's a plus, but as I said, like that clinical enthusiasm is the most important thing. We are very IMG friendly. We do only sponsor J1 visas. Next slide, please. And that's it. So we have a website that is coming up. I think I have a video recording coming up soon. So the website is not perfect yet, but we have a very good social media page. So follow us. And hopefully, I mean, Kate and Roshini, we can talk about if we can do a open house later and the end of the month. That will be great.
Thank you so much. Okay, so thank you so much to all of our PDs for giving a little glimpse into your programs. And so I'm going to start off with the first question that we had from our pre-recorded questions, and then I will go into the ones in the Q&A because I can't see them while I'm sharing the screen, so it will be just a second. So the first question that we have is regarding the 10 meaningful experiences on ARIS. Would you prefer the applicants focus on one specific strength, whether that be research or clinical experience, etc., or have a diverse list of or have as diverse of a list of experiences as possible?
I'll be happy to just say a few words about that.
Yeah.
I think that list of 10 meaningful experiences can be as different as applications are different. So if you're an applicant who has 5 things that are important to you and only 5, and you've done a lot of work in those 5 things, just list 5. I will say the application one of the most memorable applications I read was someone who had 71 most meaningful experiences. And it didn't seem like any one of those 71 experiences really rose above the others in that candidate's experience. So I would like to read applications full of things that applicants are interested in, that applicants are passionate about, and that applicants have real experience in. So if it's listed, I think, as a most meaningful experience, that's really all it should be. It should be meaningful to you as the applicant. There should be some degree of involvement with it. And there don't have to be 10, in my opinion.
I'll just add to that too. I think that's a great insight, is that when you talk about meaningful experiences, it doesn't have to be professional, it doesn't have to be medical education. It could be anything, you took a trip somewhere and then it was a meaningful experience to you, and some of those applications are the ones that actually sticks out. And you never know what's going to make you have that kind of connection with the PD that's reviewing your application. So I think it's really just being honest. If you have a really true meaningful experience, that really comes out in your application when you're writing it. And I think that's, and I don't think you should, just pad, your application with like 71 meaningful experiences, but really come up with those experiences that really represent who you are, right? Because that's really what we're looking for. That, especially that part of the application.
I agree, and I want to add one more thing with that. Sometimes I think applicants get stressed that I need to write something there, and it really shows when it is not something as meaningful. I mean, I even saw meaningful experiences as shopping experience, which might be very, very meaningful for that person, but I think that might not be as meaningful to write in the application. So that's why if there's, I'm fine not, that catches my attention, but if that is empty, I don't necessarily hold it against the applicant.
I think one thing that you have to remember is that we look at the whole application, right? So I think the personal statement actually, that's where you want to put a lot of that really truly meaningful experience that captures who you are. And in all those other sections, you can add to that But I think the most important thing is really still at least for me, it's still the personal statement.
I agree with that. I always start looking at before I even look at the scores, I start looking at the personal statements and try to get that idea of enthusiasm again.
Okay, thank you all. I have the second question. How would you suggest applicants get to know a program, and what should they keep in mind to figure out if they are a good fit for that program?
I guess I'll go first since, John took the first one. So I think attending this is great. So getting information directly from the PDs is great. Attending any kind of open houses that are available, those are good. I think the main thing is really just getting to know the residents. If you guys are invited to an interview, talk with the residents. They usually, they know the program better than a lot of the other faculty and people interviewing you. So I think really just, get to know, speak with the residents, attend their meet and greets. If you have a chance, do second looks, because it's a lot of the unspoken things that will really come through when you interact with them. Things that, are they getting along with each other? Are they getting along with faculty? Do they have like a positive atmosphere? Those are things that you can't get just from an interview process or just from an open house. I think those are things that you have to kind of see how they interact with each other. I think that's one way to kind of gauge what the atmosphere of the program is. Okay, and then that helps you kind of think about how you fit into that program.
I agree. Most residency programs also have a social media presence. Those are sometimes interesting ways of previewing programs that you might have an interest in, even before you get to meet anyone in the program. There was a question in the Q&A about differences in the application process when it was in person compared to now that many programs are virtual. And as I understand, there are probably going to be programs this year that are doing some in-person interviewing as well, but our program is not. From my point of view, I think a lot of the decision-making or evaluation of the applicant by the program takes place through the application. So most of what we are reviewing from the applicant is contained in the application. And I enjoy meeting with candidates, and it was actually more fun when you got to meet them in person, but it's still, enjoyable experience to meet with the applicants virtually. I do think it is harder for the applicants to evaluate programs because we're not sending you a full application of our program, right? You just have to pick up what we put out there on social media or on our website or in forums like this. So I don't know the best way of doing it. It is harder for the applicants, I think, to assess programs virtually than it is for programs to assess applicants virtually. But that's, again, just my opinion.
Okay, I have seen a couple different questions, so I'm going to try to roll them all into one about program signaling and how that is going to be handled by each of your programs. So I guess the question is, how is each of your programs going to handle program signaling?
Oh, well, that's the real question, and that's what we have discussions at our program director meetings about constantly, about what everyone else is doing about signals. We had, as I'm sure you all know, applicants had the ability to signal up to 3 programs last year. A high proportion of the total number of signals went to a small number of programs. So that is the main reason why we've expanded as a specialty, expanded the number of signals to 8 signals this year per applicant. I will just say that last year, we did not interview everyone who signaled us. We interviewed lots of people who hadn't signaled us, but the proportion of signals, the number of interviews in the people that signaled us was higher. So I think it counted for something. But mainly it was, if you were looking at two applications that were in all other ways equal, we would interview the signaled applicant. But I don't think it overcame any other, potential, if there's a potential red flag in the application, the signal doesn't mean more than that. And geographic preferences are even harder to interpret because they're so broad. And, we're from a small state, Rhode Island. People think, is that part of Pennsylvania, or is that like, inside of, how far is that from New York and Boston? So it's hard to know what a geographic signal, in my mind, what a geographic signal means, because the regions are very big.
I don't have much more to add, but I do value the signaling because, as everybody knows, like it was also very difficult for us. We get so many applications as program directors. We look at them and, online interviews make that challenging that this person only applied to my program because they want to do, like just an interview, rehearsal, or is this person really, really interested? So I do really dig deep into those like signaled, applicants, and, because those might be really people that might want to come in, and I want to give that person a chance to be able to talk to them. This is very similar to dating, right? Like you want to see the people that you might actually match with, similar interests and everything. And I think signaling helps with that a little bit.
Yeah, I agree. I think especially because we're a newer program, so we're actually 1 year younger than Buse's program. So we actually was accredited in 2019. So we actually never did in-person interviews. We started off with virtual interviews. But I agree. For a small program that's newer, I think the signaling definitely helps a little bit more. Kind of tell us that these applicants are actually interested. But I also agree with John though that I think. We definitely had applicants who signaled us, but we didn't interview. So, and we definitely had the majority of applicants we interviewed did not signal us. So I think it's kind of it's good if it's a match, but at the same time, when you expand to 8, then it kind of dilutes the whole signaling process. So I don't know how this year is going to go. So I'm sure there's going to be more discussions among the PDs regarding the signaling. It's not the end of it, so.
There were also a couple of questions about, does it make a difference if one chooses no geographic regional preference versus not your geographic region? Okay, so for example, my region is New England. And applicants applying, I can see whether they've selected New England as one of their 3 regions. I can see if they've selected no geographic preference, or it can be blank. If it's blank, that means they chose 3 other geographic regions that are not New England. So in those circumstances, if you truly have no geographic preference, I do think it's to your benefit to label no geographic preference, because when it's blank and New England wasn't selected, for example, I think that does show relatively less interest in our program. Whereas I think no geographic preference is no geographic preference, and those people are, the same as all of our other applicants.
Yeah, and we're part of the Mid-Atlantic, which I think like 90% of the applicants actually live in the Mid-Atlantic, just because there's so many programs concentrated in our area in the Mid-Atlantic region. So for us, it's like the opposite. Like, oh, Mid-Atlantic, that's almost like a no geographic preference for us, right? So I think I think it's like anything else in life. Just be honest, because it's really, if you have a geographic preference, just say it. It's because we want residents to come to us with knowing everything about us and us knowing everything about them, right? that's really ultimately how things are going to work out well. So I think just be honest about your geographic preferences, just be honest about your program signaling, anything with your application, really express to us what your desire is, right? Because it's not, it's not a, the ranking process looks like a game, and it almost kind of feels like a game, like you have to play, all these different factors. But at the end of the day, we want residents to really want to come to our program, and we really want to expect to kind of send that energy out to the world and kind of attract those residents to us. So I think from our standpoint, we try to be honest with what's going on with our program, and I think it's the same with the other side. Okay.
Okay, thank you, everyone. I think one of the other questions that I'm seeing a lot in the Q&A is about personal statements. I know we touched on that and how important they are, but do you guys have any specifications regarding length? Is there anything that you look for when you're reading a personal statement? What do you think an applicant should be conveying?
Just one quick point on that. Keep it to one page. I think if you should be able to concisely and consistently express your personal statement in one page, because oftentimes, if it's like 2 pages long, we're not going to get to that second page. So keep it to one page.
I think, I mean, of course, this is like this is a difficult thing to achieve for everybody, right? But when I feel like when I read them, I read 50 of them at the same time. So after a while, they all sound similar, right? Like everybody has like grandma with Alzheimer's, and it's like it is very, very similar. But like if you can really start your letter with like I don't know, like just distract me a little bit, catch my attention, so that I can be like, oh, let me look at this person's application a little bit more, or get your, again, I'm going back to that enthusiasm idea, try to like show me that you are not applying to neurology because, you cannot go into, I don't know, dermatology. I'm just making an example. Show me that you really want to become a neurologist.
Absolutely. And as someone who is not, I am not an artist or creative writer by any stretch, don't feel the need to, be the next great American novelist, or essayist in your essay. Just something that is specific to you, is really helpful, something unique, and something that demonstrates your enthusiasm and your interest, both in neurology and potentially in the programs that you're applying to. I'm not suggesting that you write a different personal statement for every program that you're applying to. I'm just saying, like, in general, the things that you're looking for in a program, you could identify as part of your personal statement.
The next question that we have is, any advice for an applicant who wanted in a way at a program they were very interested in, but was unable to get it? How, or what's the best way to get them to stand out during the application process?
I think that's something that, could be an important part of your application, or in a separate message to the program, just to say, hoping to meet you on the interview trail. I had wanted to come visit your program as an away student, but wasn't able to visit for whatever reason. I think that's something that you could communicate to the program coordinators, to the program email lists, just to make your interest known.
Very good, thank you.
Okay. One of the questions we received on our socials, for IMG applicants, do you expect them to have United States clinical experience? And additionally, does that have to be in neurology?
To that, I would say yes, because as an international graduate myself, it's a completely different system being in the US. And so especially in neurology, people first go into internal medicine, and if somebody is not familiar with, especially the US medical system, I think it is very, very difficult, especially for that person to go through the internal medicine well and learn and get to neurology. So that's why I am looking for US experience, preferably neurology, but I know sometimes it is very, very difficult, but yes.
I agree. I think US clinical experience is important. And I think neurology preferred.
Okay. How important is research in neurology, and what are some of the best ways to secure neurology research?
I talked about this a little bit during my presentation, so it is not something that I definitely look or want in an application, especially because of my program. I mean, maybe like, I don't know, Dr. Cahill might look for neurology because he's much more in an academic program. I mean, look for research in his program. But for me, again, it is all about standing out. And if having, conference experience or case report experience, something like that, I think that helps standing out. But I have given interview opportunities or match candidates that didn't have that. I don't think it is a must, but I think it helps. And also it helps, again, show the interest too. Again, if a candidate only has, like, let's say, ophthalmology research, I'm likely to think that they want to match into ophthalmology, but they are backing up as neurology, right? So
Yeah, I think research is not necessarily something that we look for, but it does help get a sense of what your interest is, and also it also tells us what kind what the person is, right? If they are go-getters and they kind of seek out research on their own, and they overcome all these adversities or barriers to research to do research, that tells us that that's something with their personality. So I think that's another facet of it is, not necessarily highlighting the content of the research, but how they actually approached it. So I think that's something that actually stands out that they've actually took the time to actually do the research and spend time doing it, right?
Not that long ago, people would often discuss the three pillars of academic medicine. There's clinical care, there's research, and there's teaching, right? But I think that there are a lot more facets to being a physician than that. And same for applicants. I think that applicants with experience in teaching, in community involvement, in leadership positions are all valuable and should be highlighted in your applications. So I would venture to say that more than half of our matched applicants do have some research background and research experience, but that less than half of our residents, about half of our residents, have a significant research experience during residency. So it's not always like the highlight of most of our residents' time in residency.
Okay, great. Thank you. I see a lot of questions in the chat about so-called red flags on the application, a failed exam attempt, or whether you would would you accept an applicant with a failed attempt? Would you accept an applicant with only COMLEX scores? Could you guys speak a little bit on that?
We do require the STEP scores, USMLE STEP scores, not COMLEX alone. We do not disqualify people for failures of any of the steps, and have had candidates match with failures on the STEP scores. There was another question about the timing of taking step 3. I have not had the occasion really to review step 3 results in applicants. Our residents are required to take step 3 by the end of PGY2 year. So most of them are taking it sometime during PGY1 or PGY2. Very, very few of our applicants have taken and passed step 3. Probably a single number, like between 1 and 5 applicants a year has actually taken step 3. So I don't use that. We don't use that as any part of our interview process.
I think for us, it's the same kind of process with us. We don't, I don't think we've taken anyone with step 3 scores, but we do have a requirement that they complete their step 3 at the end of the PGY2. And that's like an institutional thing. That's not just our program. As far as red flags for scores, we definitely review applicants who failed in the past, but what we're looking for is really improvement, right? So if you failed your step 1 and you took it again and you got a high score, that to us is actually a plus. So, and you can turn that red flag into a green flag if you show us significant progression. That's really what we want to see is, are you able to kind of overcome that adversity and show us that you can actually improve on that. So I think for us, we do review applicants who have had red flags, but what we want to see is growth. We want to see personal growth from that experience, and that to us can actually be beneficial to your application.
I would add that that is the same. I mean, if you fail a step exam before, I will still look at your application. That might require a little bit more for you to stand out comparing to the other applicants, but I think it is completely fine. I would still like to see, an explanation, like somebody acknowledging I failed this, just like Dr. Yu said, but this is what I achieved in the end. And please, please, please expect that to be asked too. If somebody asks during your interview, you failed your step, what is going on or why, or anything else related to that, don't be upset. It is part of I think, a very, very fair question. So please expect to explain that. I think, at least for our program, we are fine with the COMLEX scores. So step scores, not having taken step is completely fine. I'd like to see, step 3 doesn't matter. Again, it's an institutional or complex 3. You just need to take by the end of your second year, is the same as Dr. Yu's program. But if you haven't taken like step 1 or step 2 and scheduled to take, then that might be a little tricky, right? Because a lot of things can happen. And also we need to look for our own programs too. If a candidate fails and have a late start and everything, that also complicates things for us. So at least we need to see step 1 or step 2 and complex 1 and 2.
And on a similar note, there was a question about, another person had highlighted a red flag, and I wanted to say, I've lost my train of thought. Ha! I'll come back to it.
Yeah, just to build on the what Dr. Sengul was saying, when you get asked that question about a red flag, be honest. I think the 3 of us, we've probably seen thousands of applications and interviewed hundreds of applicants, and not to mention patients, right? We've all seen tons of patients, so we know if you're hiding something most of the time, right? So just be honest. We want honesty. It definitely looks bad. If you didn't do well because you didn't study for it, just be honest about it, right? And just say, well, but however my step 2 scores show that I have the talent to do it, right? To improve. So really, I think you get a sense of what I'm looking for, which is honesty. So.
I think the question I was thinking of now from the Q&A was, if you had not matched into a different subspecialty in years past, would that count negatively against you in applying for neurology? And my answer to that would be no. But again, I think there should be some upfront explanation as to, what you did in the year off, what made you change your mind, what are you doing now? And the personal statement is a good place to make those explanations as well.
Okay, so it is 8:55, so we are going to get wrapping up. So I am going to start sharing my PowerPoint again. Let me see where it wandered off to. There we go.
Okay,
Rich.
thank you. No, go ahead, Kate.
Yeah, I was just going to hand it over to you to start our closing remarks.
Yeah, I wish we had some more time. There are so many questions still that we will get to in our next panels. You know, we have 2 more coming up on Wednesday and Friday. So if there's, I think we've touched on quite a few components of the application and a lot of recurring themes in the Q&A box, but, you know, Kate and I will review them and see if there's anything major that we've missed out. I think maybe discussions regarding letters of recommendation in more depth can be addressed at those panels. So, you know, we hope to see you there. I think Kate has a slide on who we're going to be having. So this is our panel list for Wednesday and for Friday.
Mhm.
Okay, and of course, be sure to follow us and NMatch on X and on Instagram. We post regularly about upcoming webinars, initiatives, and, you know, we're running our mentorship program right now as well, like throughout Match season. Okay, thank you so much to all our panelists for joining us today. We really appreciate having you guys, and, you know, all of your insight was extremely valuable, and I'm sure that the applicants really, really benefited. Thank you again so much.
Thanks.
Thank you.
Yeah. Yes, thank you so
Have a good
much.
night. Bye.
Thank you.
Okay, bye-bye.
Bye.
Thank you.